Good afternoon to everybody. I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video pictures. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your beautiful faces in the video. Reminder after the pep talk, please take the online learning evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this one shown here. I placed the link in the chat box. Another reminder, obtaining 25 OLETE certificates, okay, after getting a passing score, okay, for each OLETE. So each mentee is entitled to one voucher for a ROJoson medical consultation, either face-to-face or telemedical. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please show your faces in the video now. Okay, ready? Ready? Kat, are you joining us? Okay.
Yes po, Doc.
Okay, Belet. Joining us, Belet? Bel? Okay. 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021 during the COVID-19 pandemic. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. And then from October 2021 onwards, I've been tackling health disorder courses and health issue courses. So May 18, 2024, this year marks the start of year 4 of the ROJoson PEP Talk. How long the PEP Talk will last will depend on the enthusiasm, discipline, and perseverance of everybody, okay, you and me. My PEP Talk today is entitled Medical Anecdotal Report. Okay, sorry for this one. Okay, it will be thyroid ultrasound, TIRADS, be aware and beware, okay, for today, okay, as part of your health management. So I hope to give you so that you may have an essential understanding on the TIRADS ultrasound of the thyroid. So the contents of this pep talk will be the following. What is an anecdotal report, or MAR for short, and then there'll be a narration of a case of a patient, and then there'll be insight and reflection by me. Okay. So the title of this MAR will be Thyroid Ultrasound TIRADS. So be aware and beware. So, so this is a probably it will be the first lecture for today, October 26th. So I like to have a disclaimer that the contents of my pep talk will contain my thoughts, perceptions, opinions, and recommendations, or TPORs, culled from the experiences of R.O. Hoson, me, and the writings of other health professionals. So after the narration, I will give some clarification of terms in the reflections. But before that, okay, I'll have some clarification of terms on the title first. Okay, so when you say TIRADS or TIRADS is one whole word, or there's a hyphen here, TIRADS. This is the more correct one. So it stands for Thyroid Imaging Reporting and Data System. Yeah, T-I-R, okay, A-T-S, TIRADS. Okay. Ito yung katumbas ng BIRADS. Sa breast, meron ding ganon sitwasyon. Sa breast naman, they call it BIRADS, they call Breast Imaging, Reporting, and Data System. Okay. So this thyroids is commonly seen in the reports after an ultrasound of the thyroid gland. Sa breast, ganun din. BIRADS, no? Marami na. Okay? So be aware, when I say be aware in the title, so you must have a knowledge of thyroids, its uses, usefulness, and limitations. Okay? So it's not a perfect system. So beware means, there's another word here in the title, beware means to watch out for the limitations, if not wrong interpretation and usage of thyroids on patient management. As I will tell you later on, there are a lot of confusion going on, and then there are a lot of anxiety among patients receiving this thyroids report. And then there will be some patients who will be operated on or, or needle biopsy done, okay, unnecessarily. Okay, so beware of that. So there's a October 26, 2024, as part of the title. This is the state of the MAR writing and reflection, which covers only some aspect and issues of thyroids at this time. Okay, because thyroids is a broad topic to tackle. I will not be able to tackle all the issues. So the other issues will be covered in the future and will be indexed using a different date. Okay. So the gist of the MAR, a summary of the MAR will be as follows. A 62-year-old Filipino female with multiple thyroid nodules. She was advised thyroid operation by two surgeons and an endocrinologist prior to seeing me. Bago pumunta sa akin, so nakapunta na sila sa two surgeons and an endocrinologist who were advising operation. So the main reasons mentioned were the presence of multiple thyroid nodules. Multiple means more than one. And then one nodule had a thyroid scoring of 4. Okay. Pag you say 4, usually it's equivalent to moderately suspicious for cancer. Okay. So when she saw me, my clinical diagnosis was multiple colloid adenomatous goiter, which is a benign condition. So I did a needle evaluation and aspiration biopsy on a palpable nodule. Yung nakakapako lang kasi maraming bukol ito. Okay. So gumawa ako ng needle biopsy. Then, after the needle biopsy, I gave a medical suppressive therapy. So not operation, but medications. So there was good response. And despite the decrease in the size of a thyroids 4 categorized thyroid nodule, the thyroids 4 scoring on repeat ultrasound twice at least remain. So, nung umpisa, may moderate suspicion on the first ultrasound. Tapos ginamot na, lumilit na, ganun pa rin on repeat ultrasound, minamaintain pa rin nila yung thyroids 4. So, hindi nagbabago. So this more illustrates the inflexibility of the thyroid scoring in the light of a decrease in the size of the thyroid nodule or response to the treatment. Inflexibility means hindi nila binabago, okay? Wala silang adjustment to the clinical response of the nodule to medical treatment. So kung may nag-response sa medical treatment, dapat bababa na yung thyroid, supposed to be. Hindi na suspicion for cancer. Okay? So this is the gist of the MAR. So some reflections and learning points and issues that I will be discussing with you will be, what is the thyroid ultrasound TIRADS, and how is the thyroid scoring being done? What are its usefulness and limitations? And what are my tips on management of similar situations? Before I go to the narration, I'd like to describe to you what MAR is all about. MAR is a medical anecdotal report operationally defined by yours truly as a brief written report on actual patient, actual medical event that involves an actual patient. Okay. So, totoong nangyayari ito, no? Okay, usually isang kaso, isang pasyente, sometimes it could be multiple o dalawa, tatlo, no? Okay. So the medical observation must have an impact on the reporter, that's me, in terms of insight gain. Usually, pag gumagamit ako ng pasyente, meron akong reflections, may natututo rin ako at meron akong naiisip, and which I think is worth sharing with other people, usually for learning purposes. So example, as based on the GIS, nakita ko itong pasyente, I think it's worth sharing it with other people so that I can advise the patients will be, so be aware and beware. Okay, beware, baka ma-opera kayo hindi oras, no? Okay, kung hindi niyo alam yung sitwasyon. Okay. So, the MAR has two parts, narration and insights or reflections. I'll start first with the narration. Ito, actual patient ito. I have a patient. Okay, let's call her by these initials, RBG. RBG, okay. A 61-year-old Filipino female who in August 8, 2023, okay, consulted me for her thyroid concern. Noong 2023 pa siya unang pumunta sa akin, pero ang reporting ko ngayon will be 2024. So that means may almost 1 year of follow-up na, okay? So she brought in an ultrasound of the thyroid, which showed multiple thyroid nodules on both lobes, means right and left lobe. There are two major lobes on the thyroid gland, the right and the left, divided by the imaginary yung trachea sa gitna. Okay? So some of the nodules are cystic, some complex, means may combination ng solid and cystic when you say complex, and then some solid yung walang fluid. Okay? The largest was 2.9 centimeter in the left lobe, and which was complex also. Pakimute lang ho. Okay. So, and with the thyroid scoring of 4. When you say thyroid, 4 will be moderately suspicious. Okay. So, ito yung actual records of the patients. Okay. So, she saw me August 8, 2023. Okay. Ang pulse rate niya is 80 per minute. There's a 3 centimeter nodule. Ang ultrasound niya, lumabas ay multiple nodules. So if I look at if I consider the ultrasound results, I will say, kung tama yung ultrasound, multiple nodules. That's why I call it multiple colloid adenomatous goiter. So I gave her the options, medicine muna, then walang biopsy, diretsong gamot, kasi ang impression, ang diagnosis ko is benign multiple colloid adenomatous goiter. I gave her the other option to have a biopsy, then depending on the results, pwedeng medications muna or operations. Okay, kung malaking suspetsya na cancer, operasyon. Kung ang biopsy will show benign, most likely benign, pwedeng medications. No? Okay. So ito yung definition of TIRADS. Okay. 4. So when you say TIRADS 4, it means a thyroid nodule is moderately suspicious for cancer. Ito yun, no? So TIRADS 1 is benign. TIRADS 2, not suspicious. TIRADS 3, mildly suspicious. 4, moderately suspicious. And 5, highly suspicious. So take note of these 3 words there. Mildly, moderately, highly. So kumisan may konting subjectivity. Okay? So hindi siya may mga degrees of suspicion. Hindi clear cut na talagang meron, talaga wala, gano'n. Okay? So 1 and 2, wala. No? Okay, benign yun. No? Pero doon sa 3, merong mild, may moderate, may highly suspicious. Okay. So itong pasyente nito has TIRADS 4, meaning moderately suspicious for cancer. Okay. So she was previously advised to have operation by an endocrinologist and 2 surgeons. So she came to me for another opinion. So when I saw her, I could palpate a right thyroid nodule. It was not hard, with no neck nodes, and the pulse rate was 80 per minute. ito yun. Ito yung kanina pinisent ko. Okay? So my clinical diagnosis based on my physical examination, meaning kapako, was colloid adenomatous nodule on the right lobe. Kung kasama yung the other ones, yung mga those seen on the ultrasound, it will be multiple colloid adenomatous goiter. Okay. So integrating the result of the ultrasound, sa akin yung kapako isa, no? Sa ultrasound, merong other nodules. So I said, most likely this is multiple colloid adenomatous nodule. Okay. So I put on hold a diagnosis of thyroid cancer as suggested by the TIRADS 4 score on ultrasound. Kasi yung ultrasound, TIRADS 4, suspicious for cancer. Yung sa akin naman, it's most likely benign. Okay. Small chance na cancer. So I gave the patient the following options: medicine or medical suppressive therapy without getting a biopsy, as I was more than 90% sure of my diagnosis of MCAG, which stands for multiple colloid adenomatous goiter. Ito yan, ina-explain ko ulit dito. Ito yung records ko. Okay. Or the other option is biopsy, then medical suppressive therapy if benign, and if malignant, operation. Okay. So the patient chose the option of needle aspiration biopsy. My way of management, I usually give options to the patients and then ask them what they want. Okay. Of course, with guidance from me. Okay. So this patient chose the option of needle aspiration biopsy. So ito yung nodule sa right side, i-aspirate ko. Okay. So I did a needle aspiration biopsy of the palpable thyroid nodule in my clinic. Sa clinic lang pwede na. No? Without the aid of an ultrasound. No? I obtained 2 cc of colloid fluid. Okay. So may fluid siya, colloid. There was a residual nodule after the aspiration. Ibig sabihin, may konting umbok pa. Okay, hindi siya totally, kasi pag fluid kamisan, pwedeng totally, pag na-evacuate na lahat, mawawala na yung bukol. No? So, pero ito, after the aspiration, meron pa ako may natitirang bukol. No? Okay. So, that's my gross needle aspiration biopsy was colloid adenoma. Okay. Yung adenoma consists of the solid component dun sa loob. Yung colloid is the colloid fluid. Okay. The reason for making this basis for this colloid adenoma, because of the evident colloid fluid, which I was able to get, and there was incomplete disappearance of the mass with aspiration. Kaya colloid adenoma. Kung nawala yung bukol, I can call it colloid cyst. Cyst. Ito kasi may natitira, kaya complex, may combination of solid and cystic component. Kaya colloid adenoma. The cytopathologic report of the needle biopsy showed hemorrhagic aspirate. So, dugo lang nakita. Okay. So, ito, hemorrhagic aspirate. So, I have to make a decision what could it be. Okay. So usually, kuminsan, when you do needle aspiration, you only have 90% yield, pero mataas na rin yun. No? So there's a 10% na wala kang information makukuha. So, but as a clinician, I have to do the interpretation, no? Because I was the one who did the needle aspiration. Kasi kuminsan, yung mga colloid adenoma, talagang lumalabas nito because of the complex component, kadalasan, hemorrhagic aspirate ang lumalabas. No? So despite the cytopathologic report of needle biopsy showing hemorrhagic aspirate smear, which is commonly seen in colloid adenoma, as mentioned, I maintain my pre-treatment diagnosis of colloid adenoma for the right palpable nodule. Yung nakakapako is colloid adenoma, yung inaspirate ko, and multiple colloid adenomatous goiter for the entire gland based on the ultrasound findings. Okay. Okay. So ito, colloid adenoma. Okay. Follow-up after 1 week showed decrease of the right thyroid lobe to about 2 centimeters, okay, after the needle aspiration. So informing the patient of my diagnosis after the needle aspiration, which is colloid adenomatous nodule, we agreed on a trial of medical suppressive therapy with a repeat ultrasound after 3 months. Okay. So I think records that showed that follow-up initially 3 centimeters and then ngayon again 2 centimeters, needle biopsy, gross findings. Then my diagnosis was still colloid adenomatous goiter. And then, so I tried her on, we agreed on the trial of medical suppressive therapy. So I gave levothyroxine, 100 microgram, 2 tabs once a day. Okay, then with advice of doing a repeat ultrasound after 2 to 3 months para makita kung merong pagbabago. So repeat ultrasound on November 13, 2023, that's 3 months after the start of levothyroxine, showed interval decrease, lumiit, in the thyroid gland, yung gland itself, lumiit, and then some of the thyroid nodules. Okay. Ito, okay. So interval decrease in the size of the thyroid gland with changes in the nodules. No? May mga iba lumaki ng konti, iba lumiit. Okay. So 6 months after naman, February 2024, there was a decrease in the size of the right thyroid nodule pa, and then both on palpation and based on the ultrasound. Okay. So lumit after 6 months, lumit yung size of the thyroid nodules sa kapa. Instead of 2, naging 1.5 to 2 centimeter, around that much. Okay. And then 6 months after, okay. Okay, as I said, there was a decrease. Ito yung ultrasound that showed the evidence. So, ang nakalagay dito, okay, normal size thyroid gland with interval changes in the nodules as described. No? So, which showed, okay, decrease. Ito yung the word decrease. Nakikita niyo from 2.5 from previously 2.9 naging 2.5. So there was a decrease. Okay. Okay. So but yung thyroids 4 na-maintain pa ng ultrasonographer. Thyroids 4 pa rin, pero kahit na lumiit na yung bukol. Na lumiit na yung bukol from 2.9 to 2.5. Okay. But the ultrasonographer still maintain it at 2 thyroids 4, which means moderately suspicious for cancer. Okay. So sa akin, pag lumilit na, wala nang suspetsya ng cancer. Tanggal na yung suspetsya na yun. No? Okay. So despite the decrease in the size of the biggest nodule, which is that on the right side, thyroid 4 was still maintained by the ultrasonographer. That means the nodule was still moderately suspicious for cancer. Okay, ito. Okay. 13 months after, okay, so that's more than 1 year, after the start of the medical suppressive therapy, that's on September 2024, this year, there was a decrease in size in the right thyroid nodule, okay, no longer palpable on physical examination, based on ultrasound, decreased from 2.5 to 1.1. So sa kapa, after 13 months, wala na akong makapa, okay, starting with the 3, and then after the aspiration, 2, and then after treatment, mga 1 year, halos nawala na, okay. So, pero doon sa ultrasound, merong natitira, pero lumit din, no? Decrease to 1.1 from 2.5 initially. Pero, maintain pa rin ng thyroids 4. Okay? So, as I said, okay, decrease in size. Ito yung 13 months after, nag-interval decrease in size, pero thyroids 4 pa rin na maintain. Okay? Despite na even sa ultrasound lumit 2.5 from 2.5 to 1.1. So despite the decrease in size of the biggest nodule, thyroids 4 was still maintained by the ultrasonographer. This is after the second ultrasound na. No? That means the thyroid nodule was still moderately suspicious for cancer. Okay, so I'd like to end the narration here, then I'll give my reflections in a while. So the gist, I will not repeat this anymore. Okay, that's a summary. And then some of the reflection and learning points and issues that I will be discussing are the following. Okay, what is the thyroid ultrasound TIRADS? How is the thyroid scoring being done? What are its usefulness and limitations? Then what are my tips? So the first issue will be, what is a thyroid ultrasound TIRADS? TIRADS stands for Thyroid Imaging, Reporting, and Data System. It is a reporting system for thyroid nodules, yung mga bukol-bukol. Pag walang bukol, walang TIRADS, no? Okay. So, kasi may mga thyroid na lumaki lang, walang bukol, so they don't use TIRADS, okay? But for yung mga may mga bukol, nodules, then TIRADS is being used, okay? So it's a reporting system for thyroid nodules on ultrasound. So ultrasound lang ginagamit ito. Proposed by the American College of Radiology. Okay. There are other editions of TIRADS by different organizations and countries. Okay, nag-evolve yun. No? So it started with the American College of Radiology, then other countries, nakikita nila, baka hindi masyadong valid, may konting areas for improvement, so they created their own TIRADS versions. No? So TIRADS uses a standardized scoring system for reports with the primary objective of providing users with the recommendations for when to use fine needle aspiration or ultrasound follow-up of suspicious nodules, and when to safely leave alone the nodules that are benign and suspicious. So ito yung objective, okay? So kasi baka ma-abuse yung mga needle biopsy being done left and right, kaya they created these TIRADS to serve as a guide. No? Okay. So unavoidably or secondarily in the reporting, an ultrasound diagnosis with thyroid nodule is given, whether benign or suspicious for cancer, and the level of the suspicion. Okay. To repeat, as envisioned by the original authors, the main objective of putting up the TIRADS is to decrease the number or the amount of unnecessary needle biopsy in individuals with thyroid nodules. That this presupposed that before the TIRADS, yung mga bukol-bukol, ina-aspirate halos lahat. Maraming nag-aspirate. No? Kaya they came out with this system para to minimize to be selective in doing needle biopsy of thyroid nodules. However, in the process of using the TIRADS in the ultrasound reports, evaluation of thyroid nodules found, okay, is obtained, particularly on whether the nodules are highly, moderately, or mildly and not suspicious for cancer. Okay. Okay. So ito yung sistema nila. Okay. This is from the American College of Radiology, TIRADS. This is the original version, 2017. Okay. So they make a point system, 0 point, 1.2, 3 points, 4.6, 7 points, and above. No? So kung yung mga points nito is based on these categories: composition, echogenicity, shape, margin, and echogenic foci. Okay. So I'll go to the next slide para mas malinaw. Okay. So the scoring is determined by these 5 categories on ultrasound: composition, echogenicity, shape, margin, echogenic, and others. No? So the higher the score, the cumulative score, the higher the TIRADS or TR, okay, and the likelihood of malignancy. So kung 4, okay, mas mataas, no? Okay. So sa composition, example, sa composition means whether cystic or solid. Pag cystic, usually 0 point. So usually benign yon. Outright benign yon. No? Kung may mixed solid or cystic, baka bibigyan ng 1 point. Pag solid siya, 2 points. Okay? So mas nakakatakot yung solid, no? Kasi 2 points, no? Compared to the mixed solid, 1 point. Pag cystic, spongiform yung halos parang may fluid din siya, malambot, no? Okay, 0. So when you have report of cystic sa mga ultrasound, automatically you just think that it's benign. No? So this is thyroid 1. Now, echogenicity, kasi ultrasound makes use of echoes, no, to create some pictures, no. Kung walang echo, 0, usually cystic 'yon, no. Kung hypoechoic, no, walang echo, no, walang pumapasok, no. Okay, then 3 ang score, mataas, no. Mas nakakatakot ito kung hypoechoic, no. Now, they also use yung shape nito, yung tinatawag na wider than tall and taller than wide. So, depende sa size. Ito, taller. So, they said it's supposed to be taller than wide. Hindi ko alam. Okay? Taller than wide. Then, they put 3 points here. 3 points. Okay? And then, for the margin, kung smooth ang margin mo, usually benign siya, hindi nakakatakot. Pero kung may mga lobulated, irregular, extrathyroidal extension, 3 points yon. Okay? Mas mataas, mas pointing to possible, probable cancer. Okay? Then presence of other echoes foci. Okay? Kung wala namang ibang 0. Pag may mga calcification peripheral, they put 2 points. Then may punctate echogenic. Kung macro calcification 1, then punctate echogenic foci 3 points. Okay. So I won't go into further discussion. This medyo high technical lang ito. Basta just to remember that itong basis ng TIRADS, they studied all the categories and then put some points with some criteria to base on. Okay. So the higher the cumulative score, the higher the TIRADS level and the likelihood of malignancy. Kaya pag 7 points or more, TIRADS 5, highly suspicious. Pag 4 to 6 points, TIRADS 4, moderately suspicious. No? Then 3 points, TIRADS 3. So 1 and 2, walang masyadong problema. Okay? Benign, non-suspicious. Okay. So how is the ito. Okay, this is just another summary. Okay. TIRADS 1, 0 points, benign. 2 points, TIRADS 2, not suspicious. 3, mildly. 4 to 6, moderately. Then TIRADS 5, more than 7 points, highly suspicious. So, and then after that, they come out with recommendations. May mga recommendations kung TIRADS 1, TIRADS 2, hindi kailangan in-needle biopsy. Kung TIRADS 3 and TIRADS 4 and 5, mayroon silang specified recommendation depending on the size. Kung TIRADS 3, more than 1.5, follow-up lang. Walang needle biopsy. Pero kung more than 2.5, needle biopsy. Then follow-up period will be, they recommend 1 year, 3 years, 5 years. No? Kung TIRADS 4, kung maliit, mas maliit dito, 1 centimeter, follow-up lang. Okay? And then kung more than 1.5 needle biopsy, then these are the recommendation on the follow-up period up to 5 years. Okay? TIRADS 5, kung 0.5 centimeter, follow-up. Kung more than 1 or more than 1 centimeter, needle biopsy, and then annual follow-up every year ito, for 5 years. No? Okay. So the higher the TIRADS, the more frequent is the follow-up. No? And then yung size, no? At 1.5, pinapa-needle biopsy na nila kahit na 1 point, kahit na maliit lang, pinapa-biopsy nila. So this is just a summary. I won't go through it anymore. Okay. So what are the usefulness and limitations of the TIRADS? The TIRADS has usefulness and limitations. It's not a perfect system. It is not a perfect system. It's, in terms of usefulness, it can give more detailed information on the thyroid nodules seen on the ultrasound, more information than those from the physical examination, and which can make a physician determine which nodules are benign and which are suspicious for cancer, and if suspicious, which are less likely or more likely to be cancer. So it uses the information it gets from the ultrasound study of the composition, echogenicity, structure, margin, and echogenic foci of the thyroid nodule. Compared to the physical examination, this is limited to the evaluation of the palpable nodules, yung mga nakakapalang, and only on the composition, structure, and margin. Yung mga echoes, hindi nakukuha yon kasi makukuha lang yon sa ultrasound. So, but yung physical examination can determine whether it's cystic or solid, and then kung yung margin ay well circumscribed or ill-defined, no? Pwede. Another related usefulness of the TIRADS is that it gives recommendation, so which is supposed to be acceptably reliable to the clinicians, on which thyroid nodules need to be biopsied and then which one to observe. This regulates or modulates the rampant needle aspiration biopsy of thyroid nodules. As I said before, the introduction of TIRADS, halos lahat naninidal biopsy ng mga doktor. No? So they want to decrease this frequency. In other words, it lessens the frequency of unnecessary needle aspiration biopsy of thyroid nodules. Yan ang pinaka-main objectives of the TIRADS. Okay. Now, still another usefulness of the TIRADS, so by giving an assessment of whether benign or suspicious, whether it's slight, moderate, or highly suspicious for cancer, based on the score, it helps the clinician in a more detailed assessment after physical examination of the thyroid gland as a whole and of a particular nodule. So it can supplement the yung mga evaluation ng physical examination. So it helps the clinician in problem solving and decision making in the treatment, whether to do watchful waiting, babantayan lang, or medical suppressive therapy, gamot, or operasyon. Okay. So these are the usefulness of the TIRADS. Now, as I said, it's not a perfect system. May limitations then. Okay. So the limitation is that it's not always 100% accurate. And then the positive predictive value of the malignancy, kung TIRADS 3, ang TIRADS 4, yung mga readings niyan, 6.7%. For TIRADS 4, these are part of the other system na may 4B, 4A, gano'n, no? So 20%, yung TIRADS 4, 67. So hindi siya 100%. Okay? It doesn't reach up to 90% pa nga, no? So TIRADS 5 has an accuracy of 89%. Okay, so nakikita nito yung positive predictive value sa isang study, no? So it ranges, there's a range from mga average of 34% lang, no? Okay. Okay. So risk of malignancy for TIRADS 3 to 5, no? So from 3, 5% lang malignant. Then, kung TIRADS 4, binasahan ka ng TIRADS 5, type 4, ang range mo, nakita mo, ang laki, no? 5 to 80%, no? So, no to wide range, no? And then, kung TIRADS 5, highly suspicious, ito, mas mataas, pero hanggang, ano lang, usually mga 80% lang, no? Okay. So the TIRADS, another limitation that was observed in this medical anecdotal report is that the TIRADS scoring does not factor in the clinical course of the thyroid nodules, particularly the interval changes in the size as illustrated in this MAR. So to repeat, there was a decrease, lumiit yung size of the nodule, and yet the initial TIRADS 4 was maintained. So TIRADS 4, the TIRADS does not give points to the size of the nodules, thyroid nodules. So we should be aware of that. Kasi palagi natin tinatanong, lumit na nga yung bukol, pero bakit suspicious pa rin yung for cancer? No? Okay. So my tips on the management of similar situation. Number one, not all ultrasonographer are including the TIRADS reporting. Hindi pa lahat. No? Okay. Okay. So I don't know whether there will come a day in which lahat gagamit ng TIRADS, no? But I hope if they use the TIRADS, sana i-improve nila yung reporting para to maximize the usefulness, no? A clinician can still make a diagnosis with a high degree of accuracy even without the TIRADS reporting. Okay. So even without the TIRADS, sa aking experience, pwede pa rin gumawa ng come out with an accurate diagnosis. So when you say clinical diagnosis, it's clinical examination without an ultrasound. Okay. Or you can do a clinical examination with an ultrasound pero wala yung TIRADS reporting. Na, kasi before the TIRADS came in, may mga ultrasound na tayo pero hindi pa ginagamit yung mga categorization of TIRADS. Na? Okay. So yung mga dati-dati, hindi siya nakakatakot. Kasi ngayon, kung may TIRADS, meron lang palagi may sinasabi, suspicious for cancer. Mas nakakatakot siya. No? In the presence of TIRADS reporting, a clinician should correlate the ultrasound findings with the clinical findings and the clinical course, particularly the patient, if the patient has been under treatment. So palaging isasama yung course ng anong nangyayari sa pasyente during the treatment. No? Okay. So the recommendations on needle aspiration biopsy are just recommendations. No? Recommendations lang yan. That means it can be accepted by the clinician, put on hold, itabi mo na, not really rejected, okay? Or the other, pwedeng i-reject by the clinician depending on their evaluation, okay? So that means the TIRADS is hindi yung last say sila, no? Pwedeng, it all depends on the clinicians, no? So what is important is whatever decision is made as to needle aspiration biopsy to be done or not, there must be close and regular Pakimute. Okay? Pakimute lang. Huh? Yun yun, Abet. So, what is important is whatever decision is made as to needle aspiration biopsy or not, to do it or not, there must be close and regular follow-up until one is convinced of the final near final diagnosis. So, importante yung follow-up check-up. So, nakikita nito sa MAR nito, pinalo up ko itong pasyente from almost 1 year. No? So, okay, up to now. Okay. The TIRADS has usefulness and limitations and is not a perfect system. The thyroid clinicians, when you say thyroid clinicians, these are not the radiologists or ultrasonographers. Okay, these are the ones who are in direct contact in treating the patients. No, so yung mga thyroid clinicians. So the thyroid clinician should know how to use the TIRADS in the final diagnosis of their thyroid patients. So as I said, they don't have to really follow kung ano yung sinasabi ng ultrasonographer, no? If kung sa palagay nila pwedeng i-reject, pwedeng i-put on hold, no? Or kung agree sila, i-accept nila. So, correlating with their clinical findings, particularly on the physical examination findings, which are very important, the thyroid clinicians have the options to accept, to put on hold, or even to reject the thyroid scoring. The thyroid clinician should explain to the patients the recommendations. Final decisions will be derived from shared agreement between the clinicians and the patients. Kasi a lot of times, pag nabasa ng pasyente yung report, thyroid 4, takot na takot, no? And then, sasabihin ng clinicians, kung sinabi ng on hold muna, pero sabi niya, bakit thyroid 4, baka cancer ito, no? So the thyroid clinicians will have to explain to the patients, no? Wag sila just susunod-sunod lang dun sa TIRADS reporting. Recommendations lang kasi yung mga TIRADS, no? So for the patients, my advice is don't be anxious or depressed right away. Yan ang nakikita ko palagi, no? When you see TIRADS score, suspicious for malignancy. When you have TIRADS 3 to 5, 3 kasi is mildly suspicious, no? Kasi yung the word suspicious for cancer, nakakatakot na yan, kahit na mild, moderately, or highly suspicious, di ba? Okay. So you consult a thyroid clinician who knows how to palpate your neck accurately. So importante yung clinician, yung kumakapa ng leeg para ma-correlate yung thyroid's scoring, the findings, no? Rather than going to a thyroid clinician, hindi kumakapa, who rely just on the ultrasound, yan ang medyo alanganin, no? Okay, to your disadvantage, no? So look for a thyroid clinicians who will palpate your neck and who knows how to palpate your neck accurately. So we know that hindi lahat ng doktor marunong kumapa ng thyroid na in an expert manner, no? Now, number two, you look for a thyroid clinicians who knows how to interpret and evaluates the TIRADS reporting in correlation with the physical examination findings. Kasi may mga clinicians who just, sinabi ng ultrasound, yun eh. So tanggapin na lang natin, let's just accept it as gospel truth at gawin na natin kung anong dapat gawin. No? Okay. So as I said, the clinicians have the options not to follow. Recommendations lang naman yun. No? Number three, uh, look for a thyroid clinician who explains the probable diagnosis well and adequately. Okay, there's no such thing as 100% true final diagnosis palagi. Na? So may mga options pa yon. So dapat marunong mag-explain yung doktor. No? Okay. Then lastly, who can explain and give options for treatment, no? Such as close observation and follow-up is one option, okay, just like in DISMAR. Then medical suppressive therapy, just like in DISMAR, needle aspiration, and then operations, no? So operations is an option kung talagang maniniwala yung clinicians na highly suspicious for cancer. For the others, kung di highly suspicious for cancer based on clinical examination, they can opt for close observation, follow-up, medical suppressive therapy, and needle biopsy, no? Needle aspirations. So this ends my report. Okay. Summary takeaway. I have presented MR. I have presented a patient and then give my insight and reflection. Okay. So let me repeat the summary of this MR. A 62-year-old Filipino female with multiple thyroid nodules based on ultrasound. She was advised thyroid operation by two surgeons and an endocrinologist prior to seeing me. The main reasons mentioned were the presence of multiple thyroid nodules. Yan ang first one reason given by the doctors who saw the patients right before me. Then one nodule has a thyroid scoring of 4 kasi. So when she saw me, my clinical diagnosis was colloid adenomatous goiter, which is benign. So I didn't frighten the patient. Sabi ko sa kanya, benign siya. I did a needle evaluation and aspiration biopsy on the palpable nodule, okay, just to verify the diagnosis of colloid adenoma. Then after I got needle, after I did the needle biopsy, in which I still think that it was a benign nodule, I gave a trial of suppressive therapy, medical suppressive therapy, medications lang. So there was good response, no, lumiit at nawala. Okay, so despite the decrease in the size of the thyroid's 4 categorized thyroid nodule on ultrasound, the thyroid's 4 of scoring of repeat ultrasound remained the same, okay, twice at least. So this more illustrates the inflexibility of the thyroid scoring in the light of decrease in size of the thyroid nodule and response to treatment. So yan ang ibig sabihin ng beware. So beware of the inflexibility and beware of all those thyroid scoring, which can be sometimes confusing and sometimes causing unnecessary anxiety. No? So I have given some reflections and learning points and issues. What is thyroid ultrasound TIRADS? How is thyroid scoring being done? What are its usefulness and limitations? And then what are my tips in the management of similar situation? Takeaway in relation to patient empowerment, be always in touch with reliable medical information on thyroid ultrasound TIRADS. Knowledge is power. It gives power. Use the 4Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions on interpretation and management of thyroid ultrasound TIRADS as part of your health management. So this ends my pep talk today. Medical anecdotal report. Okay. Thyroid ultrasound TIRADS, be aware and be aware. So I hope I have empowered you to have an essential understanding on this topic as part of your health management. So before we go to the QA portion, reminder, please take the online Learning Comb Evaluation Test exercise for mastery of learning and have a perfect score to get a certificate like this. I have placed the link in the chat box. And then obtaining 25 OLETE certificates will entitle one mentee to a voucher for an ROJoson medical consultation, either face-to-face or telemedical. Then feedback, please type in your feedback in the chat box during the open forum and before we adjourn. Thank you. Let's now have a group picture taking before we start the question and answer and interactions. Please turn on your video now. Okay. Ready? 1, 2, 3. Okay. Okay, the floor is now open for questions, comments, suggestions for any improvement, and also I allow free consultation, short consultations lang. Okay? Okay. Any questions, any comments, any sharing of experiences? Pwede rin, sama ninyo. No? Anybody? Sinong meron ng thyroid ultrasound reports na containing mga TIRADS? Si Amy meron na, no? Okay. Sino pa? Belet, yung sa'yo, meron? You have a thyroid, di ba? Belet?
Wala po, Doc.
Walang TIRADS. Meron
Wala
kang,
po.
okay, good. Kung minsan, mas gusto ko pa, wala nang TIRADS.
Mhm.
Naguguluhan nga rin ako eh. Si Jeng, may TIRADS ba yung sa'yo, Jeng De Castro?
Doc, dati nag-thyroid sport tapos nung latest na ultrasound nung dinala ko sa inyo, naging 3 naman po.
Okay. O nga, nagbabago. Kaya sinasabi ko, how accurate, question ko, how accurate. It all depends kung sinong gumagawa. Di ba? Four nagiging 3 in different institutions. Kung minsan in the same institution, ibang ultrasonographer gumagawa, nagbabago rin. Di ba?
Yes po.
Okay. So anybody else who has experience with Rochelle, meron kang thyroid? Rochelle?
Wala naman po, Doc. Pero the
Mer-
last time I had my check-up with you last December 2023, Doc, medyo
Oo.
elevated po yung TSH, pero FT3, FT4 normal. So you recommended na kung gusto ko, magpa-ultrasound ako. Pero I trusted your kapa, Doc. Sabi mo naman po sa kapa mo, wala naman. So I did not do my ultrasound yet, up until now.
Pero dati may ultrasound ka?
Wala pa rin po talaga.
Okay. So never had experience with ultrasound?
Wala pa po.
Okay. Sige, pag hindi kailangan, huwag kayo magpa-ultrasound, ha?
Yun nga po,
Paliligo
yung
lang
sabi
kayo.
niya sa akin, Dok, wala naman po kayong nakapa. So,
Oo.
hindi po ako nagpa-ultrasound.
Oo. Kasi pag nag-ultrasound kayo, a lot of times may mga false alarm, no? A lot of times false alarms. May mga instances na tama rin naman, no? Pero pag may mga false alarm, mahirap na ilaban, no? I-negate, no? Okay. Okay.
Thank you, Doc.
Okay. Susan, yung husband mo?
Dok, wala siya dito sa house ngayon eh.
Okay.
Kaya, oo. Mas sabi ko nga sana siya, nandito siya para alam
Oo.
kong may itatanong siya.
Oo.
Ang ano ko lang, Dok, kasi di ba parang yung patient example mo, even na TIRADS 4 siya, na moderate suspicious, parang you have several, parang may monitoring ka and then meron medicine na binigay that decreases the size. So
Oo.
ang parang ano ko lang, curiosity ko lang, kung meron kang ganyan na TIRADS 4, kasi parang sa akin kasi ikaw yung doktor, so meron kang di ba na hindi mo opera ka agad kasi meron kang discarding ganito. Paano
Oo.
naman yun ibang doktor kung ipupush nila na ay TIRADS 4 yan eh. Ano yan, suspicious, kailangan operahan. Paano ko siya kontrahin? Ganon Yun lang ang ano ko.
Number
Oo.
one, wala akong magagawa.
Yung nga po.
Wala akong magagawa. No? Number
Second
two, maghanap kayo ng, mag-second opinion ka.
Kailangan sasabihin ko, kay Doc Hosong ka, gano'n. Yun ang solusyon ko dapat.
Okay.
Opo.
Honestly,
Okay.
wala akong gagawa. Kaya ako
Apo.
nag-zoom ng pep talk para to
Apo,
empower you.
opo.
To empower you na lang.
Oo.
Mahirap
I
palitan
hope,
yung,
oo.
mahirap palitan yung mga practices ng mga ibang doktor. No?
So
Okay.
I pray na talaga, ay may mag-consult sa akin para, ay hindi ka operahan, sasabihin kong gano'n.
Sige. So
Sige po.
you can try to help me propagate my advocacy to help other people para hindi sila ma-opera na di kailangan, no?
Apo.
Okay. Marami diyan no? Okay.
Apo.
Of course, may mga pasyente na
Parang
kailangan.
si husband ko, di ba, kahit benign, pina-opera niya kasi hindi naman siya kinontra nung doktor niya na, kaya yan ng gamot, walang ganun-ganun. Yun. Kaya nipatanggal niya.
Okay.
Okay. Thank you, Doc.
Sige, welcome. Anything else? I bet meron bang questions sa chat box?
Let me see. From Amy Gonzalez, are there medicines prescribed to decrease the size of the nodules?
Yeah. Yeah, yan yung kinuwento ko, yung sa MAR, usually levothyroxine ang ginagamit ko. No? Levothyroxine. No? So, yan ang madalas gamitin. Of course, I don't know, kasi sabi ko, marami kaming klaseng doktor. I don't know kung other medications na ginagamit ng ibang doktor. Especially, ang alam ko, yung mga nagpa-practice ng alternative medicine, they have their own concoctions, no? Okay, meron silang sariling gamot, no? Which I'm not familiar with, no? Okay. And then, yun, yung aking usual gamutan is, kung we're talking about itong benign colloid nodules, levothyroxine ang usually binibigay ko, no? Levothyroxine, no? So, but okay, kung ang my experience is more than 90% effective siya. Okay. So, basta to decrease the size, ang pinaka-importante to decrease the size. Kung multiple nodules, kadalasan hindi mawawala totally yon. Basta importante, lumit lang siya, no? Na hindi mo kailangan pa-opera, no? Okay. And then dapat tama ang dosage, no? Tama ang dosage, no? Minsan, kadalasan, kulang ang dosage, kaya hindi lumiliit, no? Ang hindi siya lumiliit, sasabihin sa'yo, pa-opera ka na, di ba? Kadalasan ganon, di ba? Okay. Okay. Okay, any more?
Ako, Doc, magkaiba yung thyroid ko.
Okay, thyroid. Sa'yo, Kat. Nandiyan ka pala. Okay.
The first diagnosis thyroid 3.
Three.
Nabaliw ako, Doc, kasi yung sinearch ko siya sa Google, iba meaning. So, parang feeling ko nung time na yung cancer. Then, the second diagnose nung kayo na nag-opera is thyroid 2.
Again, ang unang ultrasound mo,
Thyroid
before, Thyroids 3 before you were operated on.
Yes, Doc.
Then, pero lumabas, may microcarcinoma.
Nung thyroid, yes, papillary microcarcinoma, Doc.
Kasi multiple nodules, di ba? Okay.
Yes po.
Multiple nodules, kaya yung thyroid 3 ba binasa lahat? Thyroid 3? Lahat ng nodules
Yung,
ba?
nakalimutan ko na, Doc eh. Basta alam ko lang thyroid 3 siya, yung 2022 ko. Then, no, 2023, thyroid, thyroid 2 siya, multiple colloid goiter.
Okay. So, that was before I operated on you, ganon?
Yes po, thyroid 3 po
Okay.
yun.
Pero yung una, kasi meron kang diagnosis ng papillary carcinoma, di ba? Micro. No?
Yes, Doc. Thyroid 3.
3.
Yes po.
Okay.
Nung naoperahan nyo na po ako, thyroid 2 na siya. Nung lumabas.
Okay. Nasaan yung una mo? Right or left?
Left.
Left side. Okay, just for the information of everybody, para ma-orient lang kayo, si Kat has a thyroid nodule on the left side. Before the operation, meron siyang ultrasound with revealed thyroids 3. Tama? 3. So,
Yes po.
naoperahan siya, lumabas, cancer. Tama?
Yes po.
Cancer? Okay.
Microcarcinoma.
Microcarcinoma, yung maliit, no? Okay. So, ibig sabihin, kung minsan yung thyroids, pwede din magkamali, no? So, cancer lumabas, no? Or, you can say, hindi naman mali, kasi 3 is mildly suspicious, no? Kasi meron pa rin suspecha, no? Pero hindi siya definite na cancer, no? Okay. So, nung after the operation, so, nagdi-discuss kami ni Kat kung i-complete yung kabila, no? Kasi subtotal lang ginawa sa kanya. And then may tumubo ulit yata, no? May tumubo on the other side, no? Okay.
Yes po. Less than 10 na po siya.
Okay. So then pina-ultrasound natin kasi pag may tumubo on the other side with the background of cancer, so mas aggressive tayo, di ba? Kasi baka may umulit, di ba? So inopera natin. So, pero it turned out to be benign pa rin, no? Okay. Okay.
Okay po.
Okay. Any more questions? Wala na? Abet, anything? Unmute. Unmute.
There's nothing in the chat.
Okay. Wala na. Okay. Lance, anything that you want us to add?
Wala naman. Okay. Medyo nasabi mo na lahat about the thyroid.
Nakikita mo ba yung ginagawa sa Singapore?
Thyroid, hindi.
Thyroid, hindi. Okay. So, basta beware of the thyroids. Huwag kayo matatakot kagad, no? Okay. So, beware that, meaning it's commonly done and then a lot of time mas nakakatakot compared to the old system na hindi ginagamit yung thyroids, no? Okay. So, ngayon kasi pag thyroids 3, 4, 5, automatically meron the word suspicious, no? Suspicious for cancer, hindi mo matatanggal yung sa isipan nyo, ay baka cancer, no? Okay. Unlike before, walang thyroids, walang word suspicious for cancer, no? Bahala ng clinicians to decide, no, kung cancer o hindi, no? Okay. Okay. So I will be expounding on the mga issues pa in future cases, no? Sigurado yan, when we have a lot of Mars, palaging may thyroids yan eh, no? Okay. Okay. So kung wala na, last call. It's 3:10 na. Okay. Last call, wala na? Wala na, we'll call it a day. We'll see each other next week. Ang next week will be breast naman ulit. I-alternate natin, thyroid and breast. No? So I'll be talking about macrocyst. Pag sinabing cyst, benign, di ba? Tandaan niyo, pag may word cyst, no, ang connotation palaging benign. Hindi yung kadalasan when you say cyst, bukol, di ba? Okay, sa medicine, pag sinabing cyst, ano yan, may fluid. Yung bukol, may fluid. At usually benign siya. No? Okay. Pag yung bukol ay solid, mas nakakatakot. No? Hindi siya automatically benign. No? Okay. Pero pag cystic mass, 99% benign siya. No? Okay. Okay? So we'll call it today. We'll see each other next week. No? So, okay. Good day. Bye-bye.
Happy weekend,
Thank
Doc.
you, Doc. Happy weekend.
Thank you po, Doc.
Thank you po.
Happy weekend.
Thank you, Doc.
Thank you.
Bye-bye.
Bye.